Coronaviruses are a family of viruses that target mammals' respiratory systems. While usually limited to infecting animals, in December of 2019, a new type of coronavirus was reported in humans. This virus has grown into a global pandemic with over 2 million cases today. The whole world is being impacted by COVID-19. We're all in this together, so it is extremely important that in this time of crisis we work together to stay vigilant and stay positive. In this video, we will outline important properties of COVID-19, what parts we as citizens should play, what is currently being done to solve the crisis, and improvements we can make for the future. Many often correlate COVID-19 with the flu, but this is a dangerous assumption to make. You see, COVID-19 has a much longer incubation period than the flu. An incubation period is basically the time length between exposure to an infection and the appearance of the first symptoms. While the flu has an average incubation period of only 2 days, the incubation period for coronavirus could be as long as 2 weeks. And in that time span, someone could infect their friends and family without even knowing that they're sick. COVID-19 also has 10 times the death rate of the flu, and that's only with the current data we have. This is no laughing matter, and it's extremely important that every single one of us plays our parts during this time of crisis because our actions do influence others. Now, before moving on, we want to address the important problem of misinformation that is occurring during this outbreak. This is Dr. Rutschman from St. Louis University. She studies health law and addresses a variety of sources of misinformation.
There are many reports about the role of China in the beginning of the outbreak, including some that allege that the virus was manufactured in a lab, and official sources in the US, including in the US, say that has not been the case. So whenever you have a source in public health, public policy, etc., based on the latest available science saying this is not the case, but then you have people repeating the idea, no, this was engineered by humans elsewhere, that's a source of misinformation. There's a lot of discussion about the relationship between coronavirus and 5G internet, because as you can imagine, if you're going to have a pandemic at the scale we're having right now, obviously the most populated centers are the ones where the infection spread faster, and obviously those are some of the places with 5G networks. That doesn't mean there's causation, but that's another strand of misinformation. There's medical misinformation, so people saying that drinking bleach will prevent infection or cure the infection, which is very problematic in itself. So there's all types of misinformation, and in some cases disinformation, so deliberately people saying this to cause unrest, and this has been happening in the US for a while. So we have all this happening, which does not help the cause of vaccines we had been talking about.
So as you can see, there are multiple sources of misinformation, some of them outrageous, some of them actually believed by many people. We need to understand that currently there is no official, credible evidence that coronavirus is owned or engineered by humans. Rather than contributing to these conspiracy theories, we should be focusing on our job right now to contain the disease. Dr. Rutschman gives good advice on how to find the right information when doing so.
So if you have questions, check the sources, become more informed, again, through reliable sources. And when it comes to making personal decisions, taking your kids to the doctor to get them vaccinated, these are people who have been trained and have the proper training to advise you. So rely on experts, and if you don't want your information to come exclusively from online sources, which is probably a good idea, there are people you can talk to. It's just a matter of educating ourselves to seek out that information, I think.
Yep. So moving on, what should we as normal citizens be doing to prevent the outbreak of COVID-19? Well, the number one most effective thing you could do is, as many have probably already told you, wash your hands with soap and water. In order for COVID-19 to actually make someone sick, it needs to enter your respiratory tract, either through your eyes or nose or mouth. Soap will break down the lipid envelope of COVID-19, preventing it from entering your system. And when you wash your hands, wash them properly. Make sure to scrub your hands for at least 20 seconds. If you need a timer, the CDC says you can hum the happy birthday song from beginning to end twice. If you do not have access to soap because you're outside or something, use hand sanitizers. While these do not get rid of all types of germs and are definitely not a substitute for soap, it's better than nothing. Okay, these are key times to wash your hands. I'm gonna go really fast, so make sure you pay attention. Before, during, and after preparing food. Before eating food. Before and after caring for someone at home who's sick with vomiting or diarrhea. Before and after treating a cut or wound. After using the toilet. After changing diapers or cleaning up a child who has used the toilet. After blowing your nose, coughing, or sneezing. After touching an animal, animal feed, or animal waste. After handling pet food or pet treats. After touching garbage. Phew. The next important thing you must do is follow your government's orders and practice social distancing. I know it's not easy, but it is necessary to keep us all safe because COVID-19 is such a rapidly spreading disease, and one person could infect many, many others. So stay home, follow the law, talk to others, but use technology to help you out. And above all, let's stay positive and healthy together. Okay, so at this point you might be wondering what our scientists are actually doing to combat this disease. Well, it's definitely a multi-layered process. On the front line, there's epidemiologists who try to understand how this virus is spreading. Epidemiologists will use a variety of tools, including big data, mathematical modeling, and surveillance systems to identify patterns and traits of COVID-19, including how it spreads from person to person. We interviewed Dr. Reingold from UC Berkeley, who gives us a closer look on the circumstances of epidemiologists today.
I think there's no question that the response is using a great deal of mathematical modeling capabilities that are quite substantial around the country, around the world. Now, the problem with models is that they depend on what assumptions you make around various important parameters. People are using existing surveillance systems, building on those to this new coronavirus-related illness as best they can, and trying to implement useful surveillance systems for it. But that's sort of a work in progress to a certain extent. Many people with extraordinary computing capabilities and big data analytics are locking to the field and are quite interested in seeing how they contribute. I think one of the questions that remains to be seen is, will all these data analytics really provide new insights? Because often the data are somewhat limited in their quality. Lots of good work going on, but certainly more to be done.
So, as you can see, epidemiologists have a lot of potential in their hands, but unfortunately, because this is a relatively new disease and there's so little data, there definitely is a challenge to making the right decisions. It's not easy for anyone.
Enormous numbers of people lost their jobs. Enormous numbers of people can't pay their rent. They can't keep their businesses open. They can't pay their employees or pay for their mortgages. So the economic impact on tens of millions of people is huge. And not everyone believes that they should be following all these recommendations about hand washing and social distancing and whatever. So I think there is frustration for many people. With kids not being in school, that puts an added burden on parents, particularly working parents, to try and continue to educate their children, look after them, but still pay the bills. So it's an enormous impact on the lives of virtually everyone. And, I think the message has to be that, we are trying our best in the absence of a vaccine. That's imperfect, and if people are frustrated, I can understand that.
But it's not hopeless. In fact, do you know what Dr. Reingold's most important piece of advice to us is?
Hang in there. We are working as hard as we can to get this under control and to mitigate its effects, and eventually we will get back to some semblance of normal. So be hopeful. There may be good treatments coming. We'll see. There may well be a vaccine available in a year or so, year and a half. Be thankful for the extraordinary people we have working to take care of sick people, hospitals and clinic providers, number one, and the people who work in the front lines of public health, who are working pretty much as hard as the people in the hospitals to try and mitigate and reduce this problem at the community levels. There are people who still make sure we have food we can buy and prescription medications we can access. People are doing public safety. So, there are an awful lot of people who are working really hard in society, and we should say thanks.
There you have it. And fortunately, on top of that, Dr. Reingold says there's many ways our world could take steps to create a healthier future.
Banning trafficking of wild animals. We know that poses a risk of viruses going from animals to people, in addition to being not good for the animals and the environment. So that's a straightforward thing that we could do. Second, we need to invest in the long term in our disease monitoring and surveillance and public health activities locally, and also support those activities in low and middle-income countries. So we need a much better investment in public health. Obviously, the possibility of additional research relating to vaccines and therapeutics is important.
Yeah, and adding on to that, Dr. Rutschman says there's a lot of changes we could make to our legal infrastructure to better support vaccine development. Here's the problem right now, as she describes it.
The thing I think to understand is that vaccines are seen as a form of technology, pretty much like other types of drugs or treatments or even things that are not medical. So anything that goes into your cell phone that can be patented, the same default regime to incentivize innovation applies. And that's called intellectual property. So if you have something that solves a technical problem and that's new and meets a few other criteria, you get a patent. And because this applies pretty much to anything that's patent-worthy, the consequence is that we have not really created a system to incentivize innovation that thinks about vaccines specifically. So the idea is you get a patent for a period of time, for a number of years, you're the only one selling your invention to others, meaning we expect you to price things a little bit above the price of your product under a competitive scenario, because that's sort of the reward for your having invented something that we assume is socially valuable. So you're going to overcharge, we know that, society in general, because you get the patent. Now, with phones, maybe it's a little bit less problematic if we're paying a ton for an Apple phone and Samsung phones and the like. But with drugs and with vaccines in particular, things get more complicated. But the law is the same. The mechanism is the same. Now, if the idea is that the law is giving a monopoly or a quasi-monopoly to people who get a patent, then essentially the law is indirectly saying, from a rational economic perspective, innovators are better off if they spend money and if they do research and development on things that generate a lot of money, as opposed to things that generate less money. And vaccines, unfortunately, the majority of vaccines fall in that bucket of, drugs or biologics, that's what they are, that don't generate a lot of money or are thought of as not generating a lot of money. And that's why intellectual property, nominally, by giving you a patent, which is an exclusive set of rights, is supposed to attract people towards investment, but it doesn't with vaccines, because unless something as big as COVID happens before the outbreak, nobody's really going to invest as much on vaccines as we would hope.
This is a really big issue that takes both government and individual contributions.
Citizens directly and indirectly, by expressing their views, by listening to what candidates have to say about important things to public health, important technologies for public health, can indirectly, through votes, for instance, at least nudge the decision-making entities to move us closer to a fairer regime. What we've seen since the Ebola outbreak a couple of years ago is that we know that the government alone, and by government here I mean entities like the army or research-oriented agencies, NIH for instance, we know that alone they cannot develop and manufacture vaccines. So you can say let's throw more public money at the problem, but in practice that's unlikely to actually happen. We just don't have the resources. So what we saw after Ebola was that we have public-private partnerships emerging. And public-private partnerships, they essentially have resources from different players coming together. They've been very popular in the health space for the past 10, 15 years. And the first one focused on vaccines was created after the Ebola outbreak. So one of the possibilities is having government plus and incentivizing the formation of these types of public-private partnerships. The NIH a few days ago announced the formation of a public-private partnership just for COVID. That's for a number of drugs and for vaccines as well. So more money, yes, we need it. It's not going to come from the public sector alone because, we face resource scarcity, but there are ways to bring more players into the field.
It's not easy to make change, and there's a lot of problems going on right now, but I know there's a lot we can do, and I know there's a lot we can learn as well. So, thank you for listening to the Science Squad today, and we hope this video helped you through this tough time. You got this.